My name is Raquel Vasquez and I'm going to talk about antiphospholipid syndrome. So, what is the antiphospholipid syndrome? The antiphospholipid syndrome is an autoimmune disease characterized by the presence of circulating antiphospholipid antibodies that result in vascular thrombosis and obstetrical complications.
Hi everyone, today we're going to be talking about antiphospholipid antibody syndrome. This is another episode in our series about autoimmune conditions that affect women. Antiphospholipid syndrome is a problem with an attack on the inner lining of blood vessels. Phospholipids are little chemical components of these blood vessels. Now what this produces in terms of symptoms, or how you might even know that you have this, is it produces blood clots when you might not really have any reason to have blood clots. It produces multiple miscarriages. Also, it produces a lacy, net-like red rash on the hands and the knees. Now, antiphospholipid syndrome is pretty severe. I mean, this can really be life-threatening. And the reason I'm mentioning it to you is, number one, there's a lot of women I see in my practice that have had problems with fertility, have had miscarriages, and no one checks them for this. And I find that pretty scandalous, frankly. I would think that most doctors would want to be checking someone for this. I mean, in my practice, when anytime I see that in a history, I ask the woman immediately, what have you been checked for? And they usually say nothing. And when you see miscarriages, especially 2, 3, 4 miscarriages, you have to start thinking about autoimmunity. Antiphospholipid syndrome is one of the things you should be checking for or get checked for. Another thing is gluten intolerance, and not necessarily celiac disease because they're not the same thing, gluten sensitivity, or any other type of autoimmunity. Hashimoto's, thyroiditis is also common with miscarriages and infertility. I remember I had a case of a lady that had a car wreck, and she was a fairly bad car wreck, and she developed antiphospholipid syndrome after the car wreck. And she had a really hard time. She started going blind in one eye. So it can be a very advanced, progressive sort of autoimmune condition. A lot of autoimmune conditions are progressive, but sometimes not as rapid and as life-altering as antiphospholipid syndrome can be. Now, I want to tell you about that trauma because if you have had a car wreck or you broke a leg and then you develop some new symptoms afterwards, for example, I just had a patient the other day that was in Bolivia, and she got in a golf cart wreck and broke her teeth out. And when they tried to replace her teeth, she has had this problem now where her gums are trying to recede. She also lost about 35 pounds. Turns out she has Hashimoto's and went into a hyperthyroid flare-up of that. Physical trauma is something that is a known trigger for autoimmunity. I had a guy jet skiing a few years ago. He never had a jet ski before, went jet skiing for like 6 days, and developed an autoimmune neuropathy. These are all things we could talk about if we had a little more time, but antiphospholipid syndrome is one of these type of things that can be triggered after trauma. And you see antiphospholipid syndrome in women a lot, but you can also see it in men. Now, when I've seen this in men, it frequently shows up in people that have different types of movement disorders, that's another complicated topic to discuss. So here's the thing. What can you do about this? Well, medically, there's not a lot they do that I think is terribly successful. So you can look at these things from a functional perspective. There are things you can do to look for what might be perpetuating the immune system attacking your blood vessels. There's known triggers. There's vitamin deficiencies. There's certain food sensitivities. It could be a toxic problem. These are all things that really need to be checked. Unfortunately, when you're in the medical model, that kind of standard medical model, that little box, none of that stuff gets checked. And I personally have seen people in my practice that have done quite well getting out of that model, looking at these other things. So what you want to do is find someone that understands what we're talking about. Someone understands a functional way to look at autoimmunity. Someone that understands that antiphospholipid syndrome can show up as blood clots, as miscarriages, and you can have that rash. And there are things you can do about it. But you got to be a good detective, and you just got to find someone that'll go to bat for you.
The syndrome may be isolated or may occur in association with autoimmune disorders such as systemic lupus erythematosus. Thrombotic events represent the major complication of the antiphospholipid syndrome, and today long-term anticoagulation has been the only treatment shown to reduce vascular complications. There's no cure for antiphospholipid syndrome, but medications can be effective in reducing your risk of blood clots.
To see an MRI of your head and see a black spot in your brain, yeah, that'll sort of reinforce, yes, I had a stroke. 7 years ago, a clot had formed in an artery in Rebecca Sherman's brain. Rebecca was so incapacitated that she was unable to walk or talk. Dr. Maria DeSancho pulled her through.
Hi, Miss Sherman.
How are you?
How are you doing? Hi, Mr. Sherman.
Good. Yeah,
So, how is everything going on with you?
everything's going fine.
The main risk factors, let's say, for a stroke include hypertension, smoking, diabetes. Okay? So, she didn't have any of those risk factors. If you find that in a young person, you really have to look to try to find why this happened.
Rebecca's blood showed Dr. DeSancho that Rebecca has an autoimmune condition called Antiphospholipid antibody syndrome, or APS, a condition that can cause blood to clot more easily.
A lot, right?
And Rebecca had been taking estrogen-containing birth control pills, which can also make blood clot more easily.
Oh yeah, and then there was that.
The more kind of risk factors that you have, the more chances to have a blood clot.
33% of all strokes in people under 50 are due to APS.
Some people have these antibodies and never had any problem in terms of clotting. We don't know right now who, and that's one of the interests that I have, who having these antibodies is going to end up having a blood clot down the road. We do not know.
Hematologists do know that pregnancy increases the risks of clotting.
2 weeks. I'm having a baby in 2
God.
weeks. Talk about terrifying
Okay.
fear. Yes, I'm having a baby in 2 weeks, and I'm generally freaked out.
Well, you shouldn't be.
Like birth control pills, pregnancy also revs up the clotting system, a condition Rebecca controls with daily injections of blood thinners, medication that slows the process of blood clotting.
Okay. Which one for him?
That'll be the daddy chair.
APS can also risk the health of the baby.
This gets harder and harder each time to get up on the table.
It's the cause of up to 1 in 4 early miscarriages.
There's the baby's head, and the head is pressed up against the placenta.
What a sweat.
OBGYN Dr. Robin Kalish has monitored the health of the baby throughout the pregnancy by monthly ultrasound.
Okay, so here you can see the heart. You can see all the 4 chambers of the heart.
Oh my God, look at it.
Whenever someone has an increased risk of having a blood clot, we always worry about having a blood clot in the placenta. And so one way to tell that is looking at the size of the baby to make sure the baby's growing well. That means the baby got enough nutrients from the placenta. And the other is looking actually at the blood flow through the umbilical cord. So this is the umbilical cord. Look at the blood flowing through the umbilical cord. Hear the heartbeat?
Yeah. That's unbelievable.
It looks very good. That there was no compromise of the blood flow from the placenta to the baby.
Signs and symptoms: blood clots in your legs and deep vein thrombosis that may travel to your lungs with a pulmonary embolism, blood clots in the arteries of your arms or legs, peripheral arterial thrombosis, repeated miscarriages or stillbirths and other complications of pregnancy, such as premature delivery and high blood pressure during pregnancy, preeclampsia, and stroke. Causes: in an antiphospholipid syndrome, your body mistakenly produces antibody against proteins that bind phospholipids, a type of fat present in your blood that plays a key role in clotting, coagulation. Antibodies are specialized proteins that normally attack body invaders, such as viruses and bacteria. When antibodies attack your phospholipid-binding proteins, your blood may clot abnormally. Risk factors: having an autoimmune condition such as systemic systemic lupus erythematosus or Sjögren syndrome, having certain infections such as syphilis, AIDS, hepatitis C, or Lyme disease.
An autoimmune condition called antiphospholipid syndrome is a known cause of poor implantation and repeated early pregnancy loss or miscarriage. It impairs endometrial differentiation, which is a process that goes on in the uterus that helps and is important in proper, strong implantation. This autoimmune condition also causes blood clotting, which ultimately will affect blood flow to the developing embryo and placenta and can cause miscarriage.
Taking certain medications such as hydralazine for high blood pressure, the heart rhythm regulating medication quinidine, the anti-seizure medication phenytoin, and antibiotic like amoxicillin, also having a family member with antiphospholipid syndrome.
Charles, he was a great person, loved learning, loved life, and
13th meeting every 2 to 3 years. We know something about the biology. It's wrongly named. It's not antiphospholipid because antibodies don't react with phospholipid. They react with proteins. And we now know that the antigen is a complex of phospholipid, a carrier protein, the main ones being beta-2. This is beta-2, and the fifth domain is the site where the alleged binding takes place. Prothrombin is another carrier protein. So the science is becoming more complex in many ways. And just to bring you up to date, one of the international meetings, the meeting that's being held in Galveston this week, the previous one, it was the lupus meeting in Shanghai, and this is just one paper from Shanghai.
Cases in Ecuador. Clinical and serological characteristics of 100 antiphospholipid syndrome patients from Mexico and Ecuador were collected in a protocol form that was identical to that used to study the Europe phospholipid cohort. The most common manifestations were diverticularis, migraine, inferior extremity deep vein thrombosis, thrombocytopenia, and hemolytic anemia. Several clinic manifestations were more prevalent in Latin American than in European patients, and they include mainly neurological and cutaneous manifestations as well as hemolytic anemia. The APS has a wide variety of clinical and immunological manifestations at the onset and during the evolution of the disease, and the ethnic origin in addition to environmental and socioeconomic factors can modify the disease expression.
Oh, that's right then. Okay, so antiphospholipid syndrome is a fascinating disease, and one of the reasons it's so fascinating is it's a disease rife with controversy and disagreement. It's a battle of different sorts of philosophies, and the reason for that is, in antiphospholipid syndrome, we're often treating risk. So we're treating people who are feeling pretty well a lot of the time, and we're trying to reduce their risk of things like miscarriage and thrombosis. So the question is, how big is that risk, and how much treatment does it warrant? Because of that, there are different philosophies, which I'm going to talk to you about. But these are the objectives of the talk. First, I'd like to tell you what it is, how we diagnose it, and in terms of treatment, how do you prevent a first thrombosis? In other words, what's the primary prophylaxis? How do you prevent recurrent thrombosis? A little bit on pregnancy, and finally some new ideas in APS. And the reason for the new ideas section really is because people who manage APS are very jealous, and the reason we're jealous is everybody else has new expensive drugs and we just have warfarin. So we'd like